Howdy, I'm Dr. Islam, and in today's video, I'm going to go into some of the less common treatments and recommendations when it comes to IBD or inflammatory bowel disease. These are small little tips that I picked up over my 10 years of treating patients who have both Crohn's disease and ulcerative colitis. I recommend that I use in my everyday practice. So if you're suffering from IBD, this video is for you. Guys, let's talk about food. Howdy, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic of over 10 years of treating patients with inflammatory bowel disease, both ulcerative colitis and Crohn's disease. If you want to learn more, consider subscribing to our channel, or if you live here locally, come see us up at Gastro. We can find out what's going on, get down to the root cause, and get you feeling better. So one of the first things I recommend is try to make dietary adjustments when it comes to IBD. Now, when it comes to dietary options and inflammatory bowel disease, what I always tell my patients is that it can certainly help. It'll help out with the progression of your disease, but it's not the initial treatment. So I usually don't recommend dietary options until we can get you controlled medically. Now, once we've done that, heck yeah, man, I'm all about trying dietary options to get you feeling better. So what I typically recommend is for us to try to do more of a plant-based diet. Studies have suggested that the more red meats that you have, so specifically pork, beef, these are foods that are pro-inflammatory that can mess up and destroy your gut microbiome. And what we think is going on is that for a lot of our patients who have IBD, their gut microbiome may be the root cause or contributing cause for what is going on. So by reversing that, we can get you feeling better. So adding more anti-inflammatory foods. So prebiotic foods like fermented foods, kimchi, sauerkraut, plant-based foods, which has a lot of fiber and vitamins and minerals. Foods that are rich in healthy fats like omega-3 fatty acids, nuts, salmon, flax seeds. These are foods that are great for your gut and can help out when it comes to treating IBD. There are studies suggesting that those individuals that move from a place that does not have a Western diet to more of a Western type diet not only have a higher incidence of IBD, but they have a higher incidence of developing other gut issues as well. And so I do recommend dietary options to help out when it comes to your gut issues, to help out when it comes to your IBD, and to get you feeling better. Number 2 is stress management. I cannot tell you how important this is. There is a connection between the brain and the gut, and it's real. So what happens up here will manifest inside your gut. What happens in your gut will manifest in your brain as well. And specifically for IBD, we've seen a connection between the two. Studies have shown that the more stressed that you are, the worse your symptoms are going to be, the more flares you're going to have, and the more difficult it is to control your flares once you have them. And so stress management is a key component to treating your inflammatory bowel disease. Now, there are a lot of different ways people can manage stress, whether it's yoga, meditation, exercise, acupuncture, seeing a psychologist, or even seeing a psychiatrist. All those are fine, but find some ways to minimize stress, because I can tell you it 100% is contributing to your gut issues and making you feel worse as well. So I'll give you an example. I had a young individual in his 20s who was in medical school who was having worsening flares of his ulcerative colitis. I could not figure out why. He was on great treatments. The treatments worked in most individuals. I could not figure out what is going on. And so after talking to him, he just told me he's so stressed about school, about work, about everything else that he noticed that he just cannot manage his flares because he's so stressed out. And so it got me thinking, all right, I think this is the root cause of why he's having his issues. So what we did is I did refer him to a psychiatrist, put him on some stress medications to help out, and his colitis got so much better. We didn't change his colitis treatment. All we did was change how we managed his stress. And I will tell you, if stress is consuming your life, because it probably is, especially if you have IBD, you need to get that handled. Number 3 are nutritional supplements. Now, I have to caution you when I talk about supplements with IBD because, once again, I do not recommend using supplements when you're in active flare. And the reason that's the case is because there are some case reports of individuals who took a supplement while they were flaring and actually became very, very sick. They developed bacteremia or bad bacteria all throughout their blood. So when it comes to supplementation, I only recommend it when you are not in an active flare and you're in remission. Now, in remission, absolutely, we can try some supplements to help out. So things like turmeric, there's very good evidence that turmeric long-term can help out when it comes to ulcerative colitis. Probiotics, there is some evidence, not a lot, that using probiotics can help out when it comes to colitis. The one that we specifically recommend is called VSL number 3, and in certain conditions, it can help out. Another supplement that we commonly recommend is vitamin D and calcium. A lot of my IBD patients are calcium deficient and vitamin D deficient, which can lead to osteopenia, osteoporosis, and brittle bones. And there's some evidence that being vitamin deficient can also lead to worsening depression as well. So I do recommend for my patients with IBD to maybe consider getting their calcium and vitamin D checked and being on supplements if it is low. Another supplement I recommend is iron. Commonly, if you have Crohn's or ulcerative colitis, you are iron deficient. And the main reason is because you are bleeding somewhere in your gut or you have active inflammation. And when you are anemic, you are tired, you are fatigued, you just don't feel good, you just don't want to do anything, which will make your stress worse. So get your iron levels checked, and if you need to be on iron supplementation, consider taking it. Next is zinc. Because of the active inflammation going on in inflammatory bowel disease, you actually may be zinc deficient, and zinc is important for wound healing. So consider if you are zinc deficient to be on 50 and 30 milligrams per day of zinc to hopefully improve that. And if you are vitamin D deficient, consider getting on 1 to 2,000 international units of vitamin D every day. And if you are calcium deficient, consider being on 1,000 to 2,000 milligrams of calcium a day. But always remember, if you're going to try supplement, speak to your healthcare provider first before you try this to make sure you're not doing something harmful for you. Next is combination therapy. So for some of our patients who have IBD, using one therapy alone may not be the only option we can use to get their symptoms controlled. So for example, I have patients who have Crohn's ileitis, Crohn's in the small intestine, specifically in the terminal ileum. There are studies to suggest that combination therapy of 2 medications may be the best option for them. We do this for a lot of our patients. So if you're on monotherapy or one therapy, you're not getting the response you want, consider talking to your healthcare provider, but whether you need to add an additional medication on top of what you're on, using different mechanisms of action to control the inflammation and get you feeling better. And then lastly, getting regular checkups are essential. So having IBD is a lifelong disease. It's like having high blood pressure or low thyroid. And so you need constant follow-up and constant checkup to make sure that we're doing things appropriately for you and checking the levels that we need to check. So see your GI doctor on a consistent basis. Get your blood testing, get your stool testing, and also make sure to get your colonoscopies and imaging done as well. Commonly, I will find problems before you notice them. And that's great because we can be preemptive in coming up with a plan to get your gut taken care of for you. So please make sure you have consistent follow-up to get your gut taken care of and stay ahead of the game as opposed to behind the 8 ball. Now, these are 5 things that I use all the time that are not common treatments or options that we use for all of our IBD patients. But in my 10 years of diagnosing and treating IBD, these are things I found to be helpful and useful. If these tips resonate with you, or you have methods that you've worked on your own to help out with your IBD, comment down below. I would love to hear what you guys have to say. And if you're having issues with your IBD, or if you want a more personalized approach to get your gut taken care of, come see us up at Gastro. We can find out what's going on and get you feeling better. Well, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter so you can get videos just like this and information that can help out when it comes to your gut health. Guys, thank you for watching. Don't forget to click here for more videos on what you can do to get your IBD taken care of.